Thank you very much. Hi, I'm Christoph Mueller. I'm a clinical lecturer in old age psychiatry, which means half of my time I'm actually looking after kind of older people over the age of 65 who have mental health problems, including dementia, and the other half I'm studying dementia using routinely collected data. And kind of the data I'm using comes from South London and Maudsley NHS Foundation Trust, which is probably the largest mental health and dementia care provider in Europe, if not the world, looking after 1.3 million people in southeast London. And kind of via the clinical record interactive search system, we actually have access to more than 300,000 anonymized patient records, and 20,000 of those patients have dementia. And the one example I'm kind of going to talk about today is dementia with Lewy bodies, which is kind of a less well-known form of dementia, but it is actually the second most common form of neurodegenerative dementia. And about 10 to 15% of all people with dementia actually have those abnormal proteins called Lewy bodies in their brain. And this is really important because people with Lewy body dementia have a much worse prognosis than, for example, people with Alzheimer's disease. As you can see on your left, where we kind of did a meta-analysis and combined all the studies assessing survival after a diagnosis of dementia, those people with dementia with Lewy bodies called DLB almost live 2 years shorter following receiving a diagnosis. But what is probably equally important, dementia with Lewy bodies is often not recognized or misdiagnosed, like in the actor Robin Williams, where they only found out after his death when they did an autopsy that he had quite severe Lewy body dementia when they looked at his brain. And basically, sometime later, his wife Susan wrote an editorial in the journal Neurology called "The Terrorist in My Husband's Brain," where she described what she called a firestorm of symptoms Lewy body dementia was sending their way, including paranoia, delusions, sleep problems, depression, and extreme anxiety, which are what we kind of call neuropsychiatric symptoms in dementia. And kind of no other form of dementia has such a high burden of those symptoms, which then, of course, leads to a higher burden also for the carer. Those patients with dementia with Lewy bodies are more frequently admitted to nursing homes and much earlier in the disease course, and care for them just becomes very costly. So, and what we kind of wanted to do with our data, and that's kind of on your left, we wanted to find out if people with dementia with Lewy bodies are more frequently admitted to general hospitals, so non-psychiatric hospitals like King's College Hospital. And what we really found in comparison to patients with Alzheimer's disease, we found that people with dementia with Lewy bodies were admitted 50% more often, and in each year they spent about 4 days more in hospital than people with Alzheimer's disease and were generating about £500 more hospitalization cost. And that's only one patient. And we actually assume that there are 80,000 people suffering from Lewy body dementia in the UK. And if you compare those 80,000 people with Lewy body dementia with 80,000 people with Alzheimer's disease, they will actually have each year 27,000 additional hospital admissions. They will have each year, they will spend 300,000 days more in hospital, and each year they will generate £35 million additional hospitalization costs. And what you can kind of see on your right is kind of when we started to explore one reason why older people might be admitted to hospital. And one frequent reason is something called delirium, so kind of an acute confusional state, which usually comes on relatively swiftly because of some form of insult, like commonly in an infection in older people. But what is important that in people with dementia with Lewy bodies, this just is part of the condition. They can just regularly have an afternoon or a day where they are terribly confused, and that kind of goes away without any treatment. And the real danger is because that delirium is often treated with kind of antipsychotic medications, which are very, very harmful for people with Lewy body dementia and need to be avoided. And what we kind of could show from looking at our routinely collected data in the patients with DLB, that making a diagnosis of dementia, the incidence of delirium episodes the clinicians recorded dropped to basically 1/3, while in patients with AD, Alzheimer's disease, basically nothing happened. So that could just show that it is so important to make that diagnosis of Lewy body dementia. So in summary, kind of dementia with Lewy bodies seems to be continues to be under-recognized and under-researched, but has a major impact on families, carers, and society. And what our research shows on those conditions which are hard to identify and have not kind of entered the limelight as much yet, routinely collected data can be really helpful for to generate a base of knowledge. Thank you very much.